Hello there. Today, we're going to talk about something that might sound a little scary at first, but is actually a fantastic way to save a tooth root canal treatment. Imagine your tooth is like a tiny house. On the outside, you have the strong white walls called enamel. Inside that house, there are softer layers, and right in the very center is a special room called the pulp chamber. This room contains the tooth's nerve and blood supply, which is like the house's electricity and plumbing. A root canal is simply a procedure to carefully clean out this inner room when it gets infected or damaged, allowing you to keep your tooth instead of having it taken out. It is a very common and successful treatment that dentists perform every day to help people get out of pain. Many people have heard worrying stories about root canals, but modern dentistry has made the procedure much more comfortable and straightforward than it used to be. Think of it less like a scary operation and more like a deep cleaning for the inside of your tooth. The main goal is to remove the source of the problem, the infected or inflamed pulp, and then seal the tooth to protect it from any future trouble. By doing this, your dentist is not just stopping the pain you might be feeling. They are also saving the natural structure of your tooth, which is always the best option for your overall dental health. Keeping your own tooth helps you chew properly and keeps your other teeth in their correct positions. The name root canal itself can sound a bit intimidating, but it simply refers to the natural canals inside the root of your tooth. These are the tiny passages where the nerve and blood vessels live. When a dentist performs a root canal treatment, they are working within these very small spaces to fix the problem. It is a highly skilled procedure, a bit like a watchmaker repairing a delicate watch. Your dentist uses special tiny instruments to navigate these canals, ensuring that all the damaged tissue is removed. The entire process is done with the aim of preserving your smile and making sure your mouth stays healthy for years and years to come. So, let's put aside any old fears you might have heard. A root canal is a positive step towards a healthier mouth. It's a rescue mission for your tooth. In the following sections, we will walk through everything you need to know, from why you might need one to what happens during the treatment and what to expect afterwards. My goal is to give you clear, simple information so you can feel confident and relaxed if you ever need this treatment. Remember, knowledge is the best medicine, and understanding what's happening is the first step to feeling better and taking control of your health. Listening to your tooth's SOS. So how do you know if your tooth is sending out an SOS signal for a root canal? The most common reason is a deep cavity. When tooth decay is left untreated, the bacteria can travel all the way from the outer enamel into the soft pulp at the center of the tooth. This causes the pulp, which is full of nerves and blood vessels, to become infected and inflamed. This infection is what often leads to the classic, severe toothache that keeps you awake at night. The pain can be a constant throbbing ache, or it might only happen when you bite down or drink something hot or cold. It's your tooth's way of shouting that it needs help right away. Another common reason for needing a root canal is an injury to the tooth. Imagine you're playing sports and you get a knock to the mouth, or you accidentally bite down on something very hard like an olive pit. This can cause a crack or a chip in the tooth. Even if the crack is too small to see, it can be deep enough to allow bacteria to sneak into the pulp chamber. Sometimes the trauma itself can damage the nerve directly, even without a visible crack. In these cases, the nerve might slowly start to die, and an infection can develop days, months, or even years after the initial injury occurred. Sometimes a tooth that needs a root canal doesn't cause any pain at all, which can be confusing. You might only notice a small pimple-like bump on your gum near the tooth. This is called a dental abscess or a gum boil. It's a sign that the infection inside the tooth has become so advanced that it has spread out through the tip of the root and is trying to drain out into your mouth. You might also notice that the tooth is starting to look darker than the ones next to it. This discoloration happens when the pulp inside has died and the blood supply has broken down, staining the tooth from the inside out. These are silent but serious signs that the tooth's inner health is in trouble. Ultimately, the need for a root canal boils down to the health of the pulp. Whether it's from deep decay, a crack, repeated dental work on the same tooth, or a sudden injury, the result is the same. The pulp becomes irreversibly damaged or infected. When this happens, the body cannot heal the pulp on its own. The only way to save the tooth and stop the infection from spreading further into your jawbone is to perform a root canal treatment. Your dentist will use X-rays and special tests to confirm that the pulp is damaged beyond repair, and that a root canal is the right course of action to bring your tooth back to health. Let's walk through the journey of a root canal procedure, step by step, so you know exactly what to expect. The very first step is making you comfortable. Your dentist will start by numbing the area around the affected tooth with a local anesthetic. This is the same type of numbing injection you would have for a filling. The goal is to make sure you don't feel any pain during the treatment. Many people are surprised to find that the procedure feels very similar to having a regular filling done. To keep the tooth dry and clean during the process, your dentist will place a small rubber sheet, called a rubber dam, around the tooth. This isolates the tooth from the rest of your mouth. Once the tooth is completely numb and isolated, the next step is for the dentist to create a small opening in the top of the tooth. If it's a back tooth, a molar or premolar, the opening is made on the chewing surface. If it's a front tooth, the opening is usually made on the back side. This small access hole allows the dentist to reach the infected or damaged pulp inside the pulp chamber and root canals. Think of it like a surgeon making a tiny, precise keyhole opening to perform an operation. This step is done carefully to preserve as much of the healthy tooth structure as possible, while providing a clear path to the problem area inside. Now comes the most important part, the cleaning. The dentist will use a series of very small, flexible instruments, often called files, to carefully remove the damaged pulp from the pulp chamber and root canals. These files are used to gently clean and shape the inside of the canals, making sure all the infected tissue and bacteria are gone. During this process, the dentist will also use a special liquid to flush out the canals, washing away any debris and disinfecting the area. Your dentist may also take 1 or 2 X-rays during this stage to make sure they have reached the very tip of the root and that the canals are being shaped correctly. This is the deep cleaning that saves your tooth. After the inside of the tooth is thoroughly cleaned and dried, the final step of the treatment is to fill and seal it. The dentist fills the now empty root canals with a rubber-like biocompatible material called gutta percha. This material is sealed in place with a special cement to ensure that the canals are completely closed off from any future infection. Finally, the small opening in the top of the tooth is closed with a temporary or permanent filling. Because a tooth that has had a root canal can be more brittle, your dentist will almost always recommend placing a crown on the tooth later to protect it from breaking and restore its full function. While the most common reason for a root canal is to treat a painful infected tooth, the procedure has several other important applications in dentistry. One key use is to save a tooth that has been severely damaged by trauma. For instance, if a tooth is badly broken or fractured in an accident, the pulp may be exposed to the outside world. In this situation, a root canal is necessary to remove the exposed and contaminated pulp before the tooth can be rebuilt with a filling or a crown. Without the root canal, the exposed pulp would quickly become infected, leading to severe pain and a dental abscess. The treatment allows the dentist to save the root of the tooth as a foundation for a new restoration. Another important application is in treating a tooth with an advanced, non-painful infection. As we mentioned earlier, sometimes a tooth's nerve can die slowly without causing any significant pain. This can lead to a chronic abscess, which is a long-term, low-grade infection at the tip of the tooth's root. This infection can slowly eat away at the jawbone around the root. A root canal is the only way to get inside the tooth, clean out the source of the infection, and allow the body to heal the bone around the root. This is a preventative measure to stop a silent infection from causing more widespread damage to your jaw. Root canal treatment can also be a necessary step before certain types of dental restorations. For example, sometimes a tooth is so decayed or broken down that there isn't enough structure left to hold a crown securely. In these cases, a dentist might need to perform a root canal so they can place a post inside the cleaned-out canal. This post acts like an internal support beam, providing a strong anchor for a new core buildup and crown. The root canal makes it possible to rebuild and restore a tooth that would otherwise be too weak to save and would need to be extracted. it turns a hopeless tooth into a functional one. Finally, a root canal can be used to treat a tooth that has had previous dental work that has failed or is causing problems. For example, if a very deep filler is placed too close to the pulp, it can cause the pulp to become irreversibly inflamed over time. This condition, called pulpitis, can cause sensitivity and pain. A root canal is performed to remove the inflamed pulp and resolve the symptoms, allowing the tooth to be comfortable again. In all these scenarios, the purpose of the root canal remains the same: to remove the damaged inner tissue and save the natural tooth, preserving your smile and your bite. Although root canal treatment is, a fantastic way to save a tooth, there are certain situations where it may not be the best or even a possible option. These situations are what dentists call contraindications. One of the most common reasons not to proceed with a root canal is if the tooth is just too badly damaged to be restored afterwards. For example, if a tooth has a very large vertical fracture that extends all the way down the root, it simply cannot be saved. Even if a perfect root canal is performed, the crack will remain, allowing bacteria to constantly leak in and, cause the treatment to fail. In such cases, extracting the tooth is really the only predictable solution. Another contraindication is when there is not enough healthy bone around the tooth to support it. This can happen in cases of advanced periodontal disease, which is also known as gum disease. If the infection from the gums has destroyed a large amount of the bone that holds the tooth in place, the tooth may be very loose. Performing a root canal on a tooth that has no solid foundation is not a good long-term solution. The tooth would likely remain mobile and could eventually be lost anyway. In this scenario, the dentist might recommend extracting the tooth and addressing the underlying gum disease before considering a replacement, like a dental implant or bridge. Sometimes, the anatomy of the tooth itself can make a root canal impossible to perform successfully. The root canals inside a tooth are not always straight, simple tubes. They can be severely curved, very narrow, or blocked by calcifications, which is basically hardened tissue. While experienced specialists, called endodontists, can often navigate these challenges with advanced tools like microscopes and flexible instruments, there are rare cases where a canal is completely inaccessible. If the dentist cannot reach the tip of the root to clean it thoroughly, the treatment is likely to fail. In these complex cases, extraction might be a more predictable outcome. Finally, a patient's overall health and their own wishes must be considered. For some individuals with very complex medical conditions, or those who are severely medically compromised, a lengthy dental procedure like a root canal might not be advisable. Furthermore, some people may simply choose not to have the treatment for personal or financial reasons. It is always important to have an open conversation with your dentist about all the available options. These include root canal treatment, extraction, or sometimes even no treatment, just monitoring the situation. A good dentist will explain the pros and cons of each choice, helping you make the best decision for your specific situation and health. Section 6. A look at the risks. Being prepared and informed. Like any medical or dental procedure, root canal treatment does have some potential risks and complications, although they are not common when the treatment is done properly. One possible issue is the risk of a persistent infection. This can happen if some of the bacteria inside the complex canal system are not completely removed during the cleaning process. A tooth's root canal system can have tiny side canals and branches, like a tree, and it can be challenging to clean every single nook and cranny. If a significant number of bacteria are left behind, the infection can linger or return later, requiring further treatment, such as a retreatment of the root canal or a minor surgical procedure called an apicoectomy. Another potential complication is the possibility of one of the small instruments breaking inside the canal. The files used to clean the root canals are very fine and flexible, and in rare cases, especially in very curved or narrow canals, a piece of the instrument can separate. If this happens, the dentist will try to remove the fragment. However, if it cannot be removed, it is often possible to clean and seal the canal around the fragment. In many cases, a separated instrument does not cause any future problems, but it is a known risk that your dentist will be careful to avoid by using new instruments and a gentle technique. After the procedure, the treated tooth can become more brittle and prone to fracture than a healthy, vital tooth. This is because the tooth has lost its internal blood supply, which helps to keep it hydrated and flexible. It has also been hollowed out to some extent during the cleaning process. This is why dentists almost always recommend placing a dental crown over a tooth that has had a root canal, especially a back tooth used for chewing. The crown acts like a protective helmet, covering the tooth and holding it together, which significantly reduces the risk of it cracking or breaking in the future. Biting down on something hard before the crown is placed is a common cause of tooth fracture. Finally, there is a small risk of what is called an overfill or underfill. An overfill is when some of the filling material used to seal the canal goes slightly beyond the tip of the root. This is usually not a problem, as the body can tolerate the material, but it can sometimes cause temporary discomfort. An underfill is when the filling material does not reach all the way to the root tip, leaving a small space where bacteria could potentially grow. Your dentist uses X-rays during the procedure to ensure the filling is the perfect length, but variations in root anatomy can sometimes make this tricky. If problems arise, these issues can often be corrected with further treatment. Section 7. Sarah's story, from fear to relief. Let me tell you about Sarah, a young woman who was terrified of the dentist. For weeks, she had been feeling a nagging pain in one of her back teeth. At first, it was just a twinge when she drank her morning coffee. But soon, the pain became a constant, throbbing ache that kept her up at night. She tried to ignore it, hoping it would go away, but it only got worse. The thought of going to the dentist filled her with anxiety, especially when her friend mentioned the dreaded words, "You might need a root canal." Sarah had only heard horror stories about them and imagined a painful, terrible experience. Finally, the pain became so unbearable that she knew she had to do something. With a pounding heart, she made an appointment with her local dentist. She explained her fears, and her dentist listened patiently. The dentist took an X-ray and gently examined the tooth, confirming that deep decay had reached the pulp and caused an infection. He explained to Sarah exactly what a root canal was, using a simple model of a tooth. He described it as a deep cleaning that would remove the source of her pain and save her tooth. He assured her that with modern anesthetics, she would be completely numb and comfortable throughout the entire procedure. Feeling a little more at ease, Sarah agreed to the treatment. The dentist started by numbing her tooth, and to her surprise, she barely felt the injection. As he worked, he explained each step in a calm voice. She could hear the sounds of the small instruments, but she felt no pain at all, just a little bit of pressure. The procedure took about an hour, and when it was over, the dentist placed a temporary filling. Sarah was amazed. The terrible throbbing pain that had plagued her for weeks was completely gone. All she felt was a profound sense of relief. It was nothing like the horror stories she had imagined. A week later, Sarah returned to have her permanent crown fitted. Her tooth looked and felt completely normal again. She could eat, drink, and sleep without any pain. The experience completely changed her view of dentistry. She realized that a root canal wasn't something to be feared. It was a solution that brought her relief and saved her smile. Sarah's story is a great example of how facing a fear with the help of a caring professional can lead to a positive outcome. Her tooth was saved, her pain was gone, and her anxiety about dental care was finally put to rest. Section 8. Tom's tale, saving a smile after an accident. Now, let's talk about Tom, a teenager who loved playing basketball. During a fast-paced game, he collided with another player and took an elbow to his mouth. The impact chipped a large piece off one of his front teeth. There was no pain at first, just the shock of seeing his broken smile in the mirror. His parents rushed him to an emergency dentist. The dentist examined the tooth and saw that the break was very deep, and the pink pulp tissue was visible. He explained that the nerve was now exposed to all the bacteria in his mouth and would quickly become infected if left untreated. The dentist told Tom and his parents that the best way to save the tooth was with a root canal. Tom was worried. He didn't want to lose his front tooth, but he also didn't know what a root canal involved. The dentist calmly explained that the procedure would involve cleaning out the exposed nerve and sealing the inside of the tooth. After that, he could rebuild the tooth so it would look exactly as it did before the accident. This was much better than the alternative, which was to remove the tooth and replace it with a fake one, like an implant or a bridge, which would be a much more complicated and lifelong process. Tom agreed to the treatment. The dentist performed the root canal that same day to prevent any infection from setting in. Just like Sarah, Tom was surprised that he felt no pain during the procedure, only the sensation of the dentist working. Once the root canal was complete, the dentist used tooth-colored composite material to carefully rebuild the broken part of Tom's tooth. He skillfully sculpted the material to match the shape and shade of Tom's other front tooth. When he was finished and handed Tom a mirror, Tom couldn't believe his eyes. His tooth looked whole again. His smile was back. Tom's story shows a different but equally important use of root canal treatment. It wasn't about treating an existing toothache from decay. It was about proactive intervention to save a tooth after a traumatic injury. Without the quick thinking of his dentist and the root canal procedure, Tom would have certainly developed a painful abscess and would have likely lost his front tooth. Instead, the treatment provided a clean and stable foundation, allowing for a beautiful cosmetic repair. It highlights how root canals are a cornerstone of restorative dentistry, helping people recover their smiles and confidence after unexpected accidents. Section 9. Your tooth's second chance. A healthy smile for life. So, we have journeyed through the world of root canal treatment, from understanding why it's needed to walking through the steps and exploring real-life stories. The most important thing to remember is that a root canal is not the enemy. It is a highly successful and common procedure designed to do one very important thing: save your natural tooth. It is a rescue mission that removes infection and pain, giving your tooth a second chance to be a healthy and functional part of your smile for many more years. Modern dentistry has made the process comfortable, efficient, and far from the scary myth it once was. Keeping your natural teeth is always the best option for your oral health. Every tooth in your mouth has a role to play in chewing, speaking, and supporting the teeth around it. Losing a tooth can cause neighboring teeth to shift, affect your bite, and lead to other problems down the road. A root canal allows you to keep that tooth and avoid the more complex and costly procedures required to replace it, such as bridges or dental implants. Think of it as repairing a valuable part of your body rather than discarding it. It's an investment in the long-term health and stability of your entire mouth. The key to avoiding the need for a root canal in the first place is, of course, prevention. Good oral hygiene is your first line of defense. Brushing your teeth twice a day with fluoride toothpaste, flossing daily to clean between your teeth, and limiting your intake of sugary foods and drinks will help prevent the deep cavities that often lead to pulp infections. Regular dental checkups are also crucial. Your dentist can spot and treat small problems like early-stage decay before they become big problems that require more extensive treatment like a root canal. Don't wait for pain to be your only signal to visit the dentist. If you ever find yourself in a situation where your dentist recommends a root canal, I hope this guide has helped you feel more informed and less anxious. Ask questions, understand the process, and trust that your dental team is there to help you get out of pain and preserve your health. A root canal is a testament to how advanced dentistry has become, offering us a way to heal a tooth from the inside out. Embrace it as a positive step towards a pain-free mouth and a healthy, confident smile that will last you a lifetime. Keep smiling and take great care of your teeth. Congratulations! If you've just completed a root canal, you're already on the road to recovery and a healthier smile. But what comes next? Let's talk about essential aftercare tips and best practices to ensure your tooth heals smoothly and stays strong for years to come. First, it's normal to feel some mild discomfort or sensitivity after the procedure. This is your body's natural healing process. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage any soreness. Be sure to follow your dentist's advice on medication and dosage. For the first few days, try to avoid chewing on the treated side of your mouth. This reduces pressure on the healing tooth. Stick to soft foods like yogurt, soup, or mashed potatoes until any tenderness fades. Oral hygiene remains as important as ever. Gently brush and floss your teeth, including the treated area, to keep your mouth clean and free from infection. Just be careful not to irritate the area around your temporary filling or crown. Your dentist may recommend coming back for a permanent crown or filling. Don't skip this step. Completing the restoration protects your tooth from future damage and restores its strength. Watch for warning signs. If you experience severe pain, swelling, or notice that your bite feels uneven, contact your dentist promptly. Persistent symptoms might indicate a complication that needs quick attention. Finally, keep up with your regular dental checkups. These visits allow your dentist to monitor your healing and catch any issues early. With a little care and attention, your root canal treated tooth can remain a healthy, pain-free part of your smile for many years. Remember, aftercare is your final step in turning treatment into triumph, so treat your teeth to the best care possible. Root canal treatments often get a bad rap, surrounded by myths and misconceptions that can make even the bravest among us nervous. Let's set the record straight by debunking these myths and presenting the facts. First up, the myth that root canals are extremely painful. In reality, modern root canal treatments are designed to relieve pain, not cause it. With advanced technology and effective anesthesia, most patients report that the procedure feels similar to getting a regular filling. Another common myth is that root canals cause illness. This misconception dates back to outdated research from nearly a century ago. Modern studies have shown that there's no link between root canal treatments and systemic diseases. Root canals are safe, effective, and crucial for saving your natural teeth. You might have heard that it's better to just pull the tooth. While extraction is sometimes necessary, preserving your natural tooth with a root canal is usually the best option. Keeping your natural tooth helps maintain your bite, jawbone structure, and overall dental health. Some believe that root canal treatments take multiple, lengthy visits. Thanks to advancements in dental technology, many root canals can be completed in just 1 or 2 appointments, making the process more convenient and less time-consuming. Lastly, there's the myth that root canal-treated teeth don't last. With proper aftercare and regular dental checkups, a tooth that has undergone a root canal can last a lifetime. The key is to follow your dentist's recommendations and maintain good oral hygiene. By debunking these myths and understanding the facts, you can approach root canal treatment with confidence and peace of mind. Remember, knowledge is power, and being informed is the first step to a healthy, pain-free smile. Thank you for joining us on this journey to demystify root canals. With the right information, you can make the best decisions for your dental health. Stay informed, stay healthy, and keep smiling.